We on Facebook?
I think so, yeah.
Okay, here we go.
Hey, this is Dr. Buzz with Buckeye Physical Medicine Rehab. That's BuckeyePMR.com is the website. I'm here today. We're going to talk about hormone replacement therapy, and I'm here with a patient, Shawn. What's up?
How's it going?
So we're going to cut the break, and we're going to come back, and Shawn's going to tell us a little bit about his story, and we're going to talk about why it's so important for everyone, male and female, no matter what your age is, if you're suffering with symptoms of hormone replacement therapy, to get your blood work done. So we will be right back. Ready?
You need a water?
He's really nervous over here.
No, I'm good.
He's really nervous.
You're good? Because there's a water over there on the table if you need one.
Did he say that?
I'm good.
Okay, you're good?
I'm
All right.
good.
I just want to make sure. Okay, here we go.
Hey, this is Dr. Buzz. I'm back with Buckeye Physical Medicine Rehab. BuckeyePMR.com is the website. We're going to talk about hormone replacement therapy today, and the importance of getting tested if you're having any symptoms, you know, and there's lots of symptoms that people can have, males and females, that would be an indicator that they might be hormone deficient. You know, some of the key ones are, you know, fatigue, difficulty sleeping. Males and females both can suffer with hot flashes, night sweats, decreased sex drive, irritability, depression, urinary problems, memory loss. These are all potentially indicators for males and females that you are, you know, suffering with some type of hormone deficiency. And the crazy thing that I see in practice is hormone deficiency for males and females has zero to do with your age. So we have people that come in their 50s and their hormones are fine, and we have people that come in their 20s and they're hormone deficient. So for someone to say, well, I'm either too young, you know, to need hormones, or hey, I'm old, I for sure need them, that doesn't make any sense. It's really all determined by your blood work, and everyone's an individual. And the thing that drives me crazy is a lot of young guys in particular, you know, depending upon what kind of stress they've had in their lives and different things, they're hormone deficient, and they'll go to, you know, they'll hear the radio show, they'll go to their primary care doctor and say, hey man, I might be, have low testosterone, can I get tested out? And their doctors won't even test them. They'll look them and say, hey, you know what, there's no way you could be hormone deficient. It sounds like you're having depression, you're tired, you're not feeling good, maybe you're just depressed, you hear some Wellbutrin or some other garbage, and they don't even test them, which makes no sense whatsoever. And Shawn, I mean, tell us your story. So Shawn's with us here. We're radio, so you can't tell, but how old are you, Shawn?
I'm 30. Just turned 30.
And we were talking a little bit, like, when did you first start feeling like some of the symptoms of hormone deficiency?
Probably when I was around 24, 25. I just was low fatigue. When I would go work out, I just didn't have the energy, the stamina, I guess. You know, I'm pretty active, play softball. My jobs, I've always been active. You know, at 24, 25, you don't think that, you know, you think you should be running the world, you know.
Yeah, Superman.
Yeah, exactly. You know, and I just didn't feel like that, you know. And when I came back from Kansas City, I moved here about 4 or 5 years ago. I tried to get back into the gym. A couple of buddies.
And how old were you then? You're what?
I was 24, 25.
Okay.
Moved back, did security. Everybody there was bigger than me,
right.
So they were, you know, and I wanted to be young and again and feel that excitement, and they kind of showed me to the not so good stuff, the hormone replacements and stuff like that, and
so you're talking about like black market.
Yeah,
and,
like guy in the bathtub making stuff in the bathtub, you know what I mean, all that stuff, and had different guys telling me to take this much, take that much, and you know, I was up one day and down the other, and I know that I was just messing with everything, and then found you and.
So you were younger, suffering with symptoms, and start taking some black market stuff.
Exactly.
You know what the heck you were taking, you
Yeah.
know, and I know we were both talking about dosages, and you were taking real high doses.
Yeah, yeah. My dosages were different. Like 1 week I'd be doing this, and the guy that I got it from would say, "Well, try this, you know, try this or try that." You know, and I'm over here just not knowing anything, you know, no, you know, anything learning on it or nothing like that. So, you know, yeah, they.
And what a lot of people don't realize is when you're doing hormone replacement therapy, there's steroids and there's bioidentical hormones, and there's a big difference. So, you know, a steroid would be like an Anadrol, a Dianabol. There's lots of different, you know, different steroids out there. And a steroid is a drug that mimics a hormone. So it's not the same as what your body produces. So anytime you're taking, D-ball or equipoise, I mean, there's a million different drugs out there, steroids out there.
I tried that, the D-ball, the oral.
Yeah, and well, number one, any hormone that you take orally, testosterone, has to be methylated. They have to add a methyl molecule to it. That's the only way you absorb it. And the problem with the methylation process, and they used to do that too with, remember androstenedione, like the stuff that Barry Bonds and all those guys.
Oh, yeah.
Those were steroids too.
Mm-hmm.
They were legal. They what they did is they took so just to be clear, so bioidentical is what we do at Buckeye. Is if you're testosterone deficient, that same exact testosterone molecule that you're deficient in, we produce bioidentically, and you're putting it back in your body. So it's very safe, very effective. You're simply replacing what your body doesn't produce. A steroid is not a bioidentical. So a steroid is close to the same thing, but not the same thing. So number one, if anything you're going to take orally, testosterone wise, has to be methylated for your body to absorb it, and that methylation process means it has to double pass your liver. And in that double passing your liver process, it becomes liver toxic.
Okay.
So if people are taking oral steroids or oral testosterone and it's methylated, it makes you feel terrible. So you might get bigger. I mean, that stuff worked. Those guys were big. But when you're double passing liver, it puts a lot of stress on your liver, which will make that causes roid rage and all this other stuff because it just stresses your body out.
Right.
You know what I'm saying? And plus, there's ups and downs with it too.
Mm-hmm.
And the other key with hormone replacement therapy is being consistent and keeping it all nice and smooth and even. And the other thing you mentioned is the dosages some of these people are taking. There's a lot of people that come to Buckeye that want to take legal bioidenticals, want to get off steroids, and there's a lot of black market steroids out there. It is what it is, but they want to do it right, and when they come in, the dosages they're taking are just crazy. And if you take too much testosterone, even of a bioidentical, it has the reverse effect. And basically what happens with testosterone is if you get this process, it's called tachyphylaxis, which basically means your receptors literally shut down. So if someone's taking steroids for a long period of time, their testosterone receptors shut down. So in essence, even though they have all this testosterone circulating in their body, they can't use it. So they would have all the same low T symptoms, low energy, low libido, erectile dysfunction, all this stuff. And it happens all the time. And there's a patient, we have a clinic in Miami. He's going down there today. He's a 20-year-old kid, was seeing a facility in Miami. And he was just feeling terrible. And he plays minor league baseball. I just got off the phone with his dad on the way in here. But his son feels terrible and it's horrible. And they had him on like a growth hormone product and a steroid product, and his levels were through the roof. He's overloaded. He has tachyphylaxis. So step one with him is just get him off everything and get him clean.
Right.
And then we'll figure out what the heck's really going on with this guy and try to get him right. But that's the danger of taking black market stuff or going somewhere where they don't continually do blood work on you, because there's a fine line. You want to keep your levels at their optimum, which is what a normal 25 to 30-year-old healthy male is. Now, when I say normal, that doesn't mean every male. That if you're 25, it doesn't mean you're going to be there.
Right.
But it's keeping those levels there, because that's when you fight disease the best, have the most energy, recover from your workouts. That's where you want to be. But to do that properly, you got to do blood work, and you got to follow up on that blood work and be consistent with it. And that's what we do at Buckeye. So you found us, and what's the difference? So you were doing some black markets, steroids and whatever for a while. For someone listening who might be doing the same thing, and it's more prevalent than you think.
Right.
What's the difference? Why would why switch from black market to doing it the proper way?
The proper way, I've seen nothing but improvements in my attitude, my ups and my mood swings, everything like that. I just feel regular. I feel safer. Doing it through the Buckeye physical and rehab, and it just it's hard to explain, because it's just so. I just feel way better. I don't have to worry about.
You say mood swings. So what's going on?
So I mean the typical quote unquote road rage or roid rage.
And that's what happens if you're taking non-bioidentical or you're taking really high doses. You have the potential to have this roid rage where you're just
you just can't control. You don't have that fuse. Like there's always that buffer when you get angry. You can kind of decide on it. Well, should I do this or should I do that? There's really no in between. You have so much in your body that you just snap. And I've witnessed it. I've had it, and now I don't. you know, because I'm regulated. You know, I'm taking the proper dosages that I should be taking, you know, that fit my body. So.
Yeah, and people will come in. I'll be honest with you. We have a lot of spouses that come in. And one fear they have is, you know, if they take bioidenticals, am I going to have roid rage? Am I going to have, you know, this anger?
Yeah.
It's the opposite. If you have low testosterone, you're going to have a shorter fuse.
Exactly.
You know what I'm saying? So once again, it's that juggling act. I mean, that's why we do blow all the time. But you know, if you're at your optimal levels, you're going to sleep better, have more energy, and less likely to have a short fuse. If you have real low testosterone and you feel like garbage,
Yeah.
you're going to have a short fuse. And obviously, if you're taking black market or real high dose of stuff, then you know, roid rage is a real thing.
Right.
You know?
Yeah.
So it's all about moderation and doing it properly and doing it safely, and that's what we do at Buckeye. So I do want to cut the break, but then we're going to be back here with Shawn, and we're going to talk a little more about the difference between steroids and bioidentical hormones and how to do it properly. This is Dr. Buzz with BuckeyePMR.com. Cool. So I want to go back to, what do you think, Mike?
We haven't really talked about, you know, like the before and after. Like we kind of touched on it, like in a scattered way, but I would talk about where he plans to go. So he's kind of said why he came in, why you shouldn't do the black market stuff. But like, how do you feel? Like you said, as the dosage has been changing, you've been feeling a little up and down. But what I want to talk about is how you guys monitor that stuff. So as he's telling Dr. Bateman, you can make adjustments to that. You know what I mean?
You gotta listen to the adjustments.
Yeah, he ain't gonna listen.
All right, come on. I know where we're going. I got
So
it.
you're 30 years old, so what your plan is to do what? You're gonna extend this, right? You're gonna keep going.
Right.
And what I would ask
I want to
him-
stay like this. I want to stay.
Right, but I would say to him, like, what are my long-term expectations? You know?
Ask him that.
Yeah, 'cause you're just having a conversation.
All right, I'll I know where we're going.
Ready?
He wasn't even texting me. Facebook. I'm ready. Hey, this is Dr. Buzz. I'm back with Buckeye Physical Medicine Rehab. BuckeyePMR.com is the website. I'm here with Shawn, and we were talking about hormone replacement therapy. You know, Shawn's a 30-year-old guy who had low T at an early age.
Right.
What'd you do when you were younger? Did you have like you just always like high stress? Because you know, usually people, and it doesn't have to be that way, but you know, because sometimes it is genetic. But if you've had a lot of stress in your life, you know, whether mental, physical, that really speeds up that whole, you know, you're wearing your hormonal system out. Did you like play sports? Did you have any injuries? Did you have anything when you were younger? Just always been a hard worker.
What I mean, you were saying about like personal,
Yeah.
personal experiences and stuff like that. I've had issues like, well, my dad passed when I was younger. I've had stress works, like working jobs. You know, I did security since I was 18 till I was 21. I did maintenance for 4 or 5 years. You know, constantly doing stuff like that. Just being.
So you've been working pretty much since you got out of high
Yeah.
school, like just
Yeah.
hit the ground running.
Absolutely, yeah. You know, and it's all been fit physical stuff. You know, I've played softball since I was 18, and I still play now. And I've been working out since, you know, playing softball. I've always been active. I've never really just been
You're not the couch potato type.
no.
No,
I
okay.
can't. No, I don't. I mean, granted, I do, but not as much. If I can be outside doing something, I'll be doing it.
That's
So,
cool.
Yeah.
Yeah, and that's, you know, pretty typical for the people we see that come in particular, you know, males and females that come in. You know, if you're, you know, in particular at like third shift jobs or heavy labor jobs, people that not only work but then are very active in sports, these things wear out your endocrine system. It just does. And they, you know, stress. They always say stress kills. Well, stress does wear you out.
Right.
You know what I'm saying? And
Yeah.
cause your hormonal system. So if you're listening and you're younger and you have some of these low T symptoms, and you look at your past and you've had a lot of stress or you internalize a lot, you know, it's probably not depression. It's probably hormonal. Get your blood work done. You know,
I mean, because I thought it was depression.
a lot of guys do, and a
people
lot
were
of females
telling me,
too, which is crazy.
Yeah,
Like, and-
people were saying that I'm depressed or this and that. I'm like, I don't feel depressed. I feel, you know, I didn't seem like depression.
What's crazy, if you Google symptoms of low testosterone and symptoms of depression, they almost mirror image each other.
Really?
Yeah. So unfortunately, it's often misdiagnosed, and it's misdiagnosed because they'll look at you because you look healthy and say, no, your testosterone's fine. You're just depressed.
Right.
which is terrible because then antidepressants, once you start doing those, that's a slippery slope,
Right.
you know, and hard to get off. And there's some addiction factors with antidepressants. So do blood work first. If your blood work's fine, then maybe you could. I'm not saying people don't have depression. Don't take this the wrong way, but it's really simple to do blood work to see if you have a hormone issue. And if you don't have a hormone issue and you have all these symptoms, then cool. Then maybe you are depressed, and maybe see the proper type of physician for that. But if you're hormone deficient, taking depression medication is just going to make it worse.
Right.
It's just going to make it worse. And the other people got to realize is, we always have to exercise. Like, you're in really good shape. Too many people, as they get older, because they don't have energy or because they have aches and pains, just think they're too old to work out and quit working out and throw in the towel. Like, I went to, I look back, at a bunch of my friends that I went to high school with, I see their pictures on Facebook, and they're just in bad shape, and like, these people were in really good shape, males and females. At what point do you throw the towel in?
Yeah.
And a lot of that's going to be hormonal. They literally don't have the energy, or they can't recover from injuries because they don't have any hormones. And when you quit exercising, everyone has to exercise. You have to exercise till the day you die.
Absolutely.
And that doesn't mean you have to be in the gym 4 hours a day or squatting
Right.
500 pounds.
Right.
But you got to do something. You got to be moving, walking, playing tennis, something, and you should do it at least 5 days a week.
I mean, walking's the easiest one.
Yeah, but you got to do something.
Yeah,
You can't, and too many people don't have the energy. And if you don't have the energy, get your hormones checked, because if your hormones are balanced, you're going to want to work out.
Absolutely.
You're going to want to work out.
Or more.
Just like when you're younger. When you're younger, no one forced you. You wanted to work out.
Yeah.
Because you had the energy. And the same thing, there's no reason you can't have that your whole life. There's no reason you can't be working out until you're in your 70s, 80s, or 90s.
I mean, there's proof of that,
Yeah.
male and female.
100%. So, what's your quality of life worth to you? And people, worry it's going to cost a lot of money. It's not expensive, and we waste more money on our cars and stupid things that don't even count, right? Than we do on our health. And hormone replacement therapy is an expense, and it's an investment. It's an investment in yourself.
Correct.
So if you keep your hormones balanced and at their optimal levels, you're going to have less disease processes. You're going to have less aches and pains, and you're actually in the long term going to end up saving money, because you're not going to have these health crises as you get older.
Yeah.
It's going to put that stuff off.
Yeah.
And this is something you do for the rest of your life. So, I strongly feel that every male and female, my mom, she's on hormones. Everyone in my family is, because you're crazy not to.
Right.
For the little bit of money it costs, and it's safe. You can't even debate the safety factor anymore. People, isn't it dangerous? Is it going to cause this or that? Does it cause prostate cancer? Well, if testosterone caused prostate cancer, every teenage boy would have it.
Right.
Right?
Right.
Testosterone, if anything, prevents prostate cancer. When do you get prostate cancer? When you get older and have no testosterone. Right? So that doesn't even make sense.
Right.
Or for females, unfortunately, and a lot of females are petrified of hormones, and for good reason, because there's a lot of garbage medications out there, like Premarin and Provera. Those aren't hormones. And unfortunately, a lot of females would go to their doctor, and here's typically a female's first experience with hormones. Females have this hot flash thing they hit when they hit menopause, which is miserable. And so go to their doctor, and they'll say, "Hey, I'm having hot flashes," and the doctor will say, "Oh, that's because you're going through the change of life. Let's get you some estrogen," and they'll give them Premarin. Well, Premarin is not estrogen. Premarin is a drug that mimics estrogen. Premarin causes cancer. It's a known thing. And if you're taking Premarin and you're listening, or your wife's taking it, pull the warning out. It causes cancer. It makes no sense. You can take a bioidentical estrogen that doesn't cause cancer, is less expensive, and will help them live longer and be healthier. So I know people are listening to, well, why the hell wouldn't my doctor tell me that? Well, it's because there's no money in it. You can't patent anything bioidentical. You can't patent bioidentical testosterone. You can't patent bioidentical estrogen. So there's no drug reps in doctors' offices pushing it. So you just don't see it. And that's sad, but that's the way the world works. And that's why healthcare is messed up in the United States.
Yeah.
So I'll get off my soapbox on that one. But the bottom line, if you're a female listening, if you're taking any type of oral estrogen or Premarin or Provera, you're not taking estrogen, and you're taking something that's detrimental to your health. Go see somebody who's, come to Buckeye and get checked out, and you can get on bioidenticals, and they're safe and effective, and they will prevent cancer. And it's crazy for any woman to suffer through menopause. No woman should suffer through menopause, because you don't have to. All menopause is you quit producing estrogen, testosterone, and progesterone. Simply replace it. It's that simple. If your body doesn't produce it, replace it, and it's safe. It's kind of like if you're vitamin D deficient. If you didn't take vitamin D to replace it, it would be unhealthy, right? So you just take vitamin D. Simple. Why wouldn't the same hold true for hormones? If you don't produce it, simply put it back in. It's that simple. So, so long term. So you're feeling better now. No mood swings or anything like that. So you plan on working out forever, right? You're
Yes.
really fit.
Yeah, I don't want to get lazy and gain weight, bad weight.
Well, you're on the ladder all the time too, aren't you? Are you do like direct TV or something?
Yeah, I work for DirecTV.
Are you on a ladder all the time, or would you?
Yeah, try not to be on the real big ladder, but yeah, I mean, I got about a 25-pound work belt that I always have on me. I carry a mini genie or a mini ladder that folds up and stuff like that. I carry it on my shoulder, and then I got the dish, and sometimes I'm carrying about 50 pounds of luggage.
Gear up there
with everything. So I'm constantly doing that, going up and down the ladder.
Then when do you work out? You work out after work?
After, yeah.
And so many people don't do that.
Well, I never used to be like that.
Right.
Whenever I got off work, I wanted to go home, and relax, you know. And everybody was saying, "Well, go to the gym in the morning." No, I'd rather sleep. But now, you know, I can get off work, go work out for an hour, 2 hours, come back, and I still feel good and still getting a good night's sleep. So.
And everyone deserves to feel that way, and it has nothing to do with your age. You should be 40 doing that, 50 doing that, 60 doing that, 70 doing that.
Yeah.
I mean, it makes no sense to not have the energy to go either exercise before work or after work.
Because I was always afraid of the aches and pains. I always had the aches and pains after work. But
That's hormonal too. You
Yeah.
know, your testosterone in particular for males and females is the body's strongest anti-inflammatory. So if you're testosterone deficient, that's how we got into it. At Buckeye Physical Medicine Rehab. Basically, we started out as a chiropractic office, and chiropractic is great for some things, but physical, we figured out that, physical therapy is really good too, so we'll combine the two. So we got the best chiropractors with the best physical therapist. Then we realized, we're really missing that medical component too. So we integrated medical. So, Buckeye was medical, physical therapy, chiropractic, and massage. We got the best of all those professions to focus on injuries. And I was thinking, man, I got this thing figured out. We got everything covered. If someone gets injured, they don't have to, should I see my massage therapist, my chiropractor, my physical therapist? We had it all under one roof. And you know what? There were some people that still weren't getting better. And it drove me crazy. We had the best of everything, and some people weren't getting better, and I knew there had to be more to it. And that's when the whole hormonal thing, kicked in. And I was the perfect example. I had shoulder pain, and it kept coming back, and I had plantar fasciitis, these two stupid injuries. I do PT to get better. I do chiropractic to get better, and these injuries kept coming back. I got my blood work done, and I had low testosterone. I got on testosterone, and all of a sudden my plantar fasciitis was fixed. Which sounds stupid, right? Like, what the hell is testosterone to do with plantar fasciitis? But it was my body couldn't fight the inflammation.
Oh.
So I'm like, man, I got to share this with my patients, and that's when I went and got my diplomate in anti-aging, because I want to do it properly, and realized there's a bunch of junk out there, Premarin, Provera, steroids, this is all garbage. There is a proper way to do this, and the more I learned about it, the more it became my passion, because, I think it's crazy for anyone who's deficient not to be on hormones. That's how strongly I feel about it, and I got my whole family on it. I feel amazing, and everyone deserves to feel great. And just because you're older doesn't mean you should feel like garbage and not have energy, So, so if someone's listening here, what's your advice to them?
Get checked out. Do it the healthy way. Don't believe your friend or stuff like that. Do it the healthy way. Do it the right way. Go get checked out. Start feeling better.
Yeah, strongly recommend. So this is Dr. Buzz again, and Shawn's a younger guy. He's 30, and you can be 70 or 80, and the same thing's going to apply to you. If you're, we do a lot of people that are older. We do stem cells and different things like that works amazing. But these people come in and their bodies are just broken. Males and females, they're broken. And, the first thing I say to you when they come in is if you had your hormones checked, because it doesn't matter what type of PT we do, what type of chiropractic we do, what type of medical procedures we do. If you don't have any hormones, you're just going to break down again, because your hormonal system controls your remodeling system. And the way your body works is pretty incredible. Your body's always rebuilding itself.
Right.
Every single day. So it's kind of like when you leave the house, come do the radio show today, you have a little mechanic in the house, he's painting and doing this and doing that, and cutting the grass and all that stuff. That's all, but in our bodies, that's run by our hormonal system. So, and that's why when you're younger, you recover and you have injuries, and everything's faster and heals better when you're younger. As your hormonal system declines with age, so does your remodeling system. So when you stub your toe, it doesn't get better in 2 days. Right. And when you tweak your shoulder at the gym, instead of hurting for a week, it hurts for a year. all hormonal based, all of it. So, you know, a lot of people just quit working out because it hurts too bad. Or I can't do it anymore. My shoulders, you know, how many guys quit working out because their shoulders hurt?
Yeah.
I can't bench anymore, so I'm not working out, or my knees hurt. So I can't run anymore because my knees hurt or my hip hurt. That's all hormonal, man. That's all hormonal. You know, so get it checked out. But anyways, I really appreciate you coming on here.
Thanks,
And the main thing is, Shawn's a younger guy. Just because you're young doesn't mean anything. Age has nothing to do with your hormones. Nothing. So I appreciate it, and hopefully you're able to help some younger guys out that are suffering out there. And this is Dr. Buzz with Buckeye Physical Medicine and Rehab. That's BuckeyePMR.com is the website. Check it out. Come in for a free hormone assessment. We'll talk to you soon.